Hi, I'm Dr. Blink, and the question is to lift or not to lift. So an exciting topic for this month is the topic of threads. And what are thread lifts? So thread lifts is a type of non-surgical procedure to lift that sagging, aging skin as well as to stimulate collagen. So what are these threads made of? So the threads are made of a suture material like the stitches that you get, but combined with other ingredients such as poly-L-lactic acid and polycaprolactone. That's the one type of threads you get in South Africa. There's another type of thread also composed of PDO, that's polydioxanone, and each thread has got unique qualities to it. So what are the areas that are commonly treated with a thread lift? It's usually the cheeks as well as the jawline to give a bit of a brow lift, as well as neck tightening, and then you also get the body threads. Threads are still an important tool in your aesthetic toolbox, beautiful in combination therapies, and for the right patient and done by the right experienced practitioner, one can get a beautiful yet subtle lift. So the key is it's for that patient who's not yet ready for surgery. They don't want the cutting, they don't want to be hospitalized, they don't want the downtime, but they just want a nice subtle lift and contouring. Have biostimulators replaced threads in the aesthetic market? The answer is a clear no. Each one has its specific place for the right patient. So a biostimulator is all about rejuvenating the skin quality as well as tightening the skin, whereas thread lifts is about lifting, contouring, and skin rejuvenation. How long do threads last? So there are different types of threads, and the different threads last a different duration. So with the threads that I use, the poly-L-caprolactone or poly-L-lactic acid threads, these threads will last you 18 months to 2 years. Are threads painful? So the answer is they are uncomfortable, but I take all the necessary precautions to make certain that my patients are comfortable. So when you come in, you've got your friendly support team here, as well as we inject a little bit of anesthetic at the entry point, and then underneath the skin I also inject anesthetic so that the procedure is as comfortable as possible. And also for those anxious patients, I also can give you a little pill to make certain that you are relaxed on your day of your procedure. So what is the downtime for threads? So when you leave here, you will have little plasters on the entry point, skin color plasters, and those are going to stay on your face for about 2 days. So for 1 to 3 days, it's maybe not a good idea to have a party, but then after that, you might have also a little bit of puckering. So the puckering is like pleats. Remember, when I'm lifting the skin, I give it a good lift. So there might be additional little pleats on the side of the face, but that won't keep you from going out. You can cover it up with a little bit of makeup, you can wear your hair down, and that usually takes about between 2 to 4 weeks for that to settle, but you can go back to the office after 2 days and carry on with life like normal. So how do threads procedures work? So there's different types of threads in the market, and each one has got its unique characteristic. They last different durations. One might give a more subtle lift, one might give a more accentuated lift. But how I do it is usually depending on which area that I'm treating. So always I anesthetize the area with a bit of lignocaine, and then I make a little needle prick, so there's no cutting, there's no knives, there's no blades involved, and then I insert the thread, and the thread is on a cannula, which is a blunt needle which contains a thread. I insert that needle, then I pull it out, and as I pull it out, this thread comes out and hooks underneath the skin. So the thread has got these little barbs on it. They call it multicentric barbs. In other words, it goes in different directions, and that hooks the sagging tissue and gives you that gentle and subtle lift. So one of the concerns which patients come to me about when having threads is they've heard stories from their friends or other patients that have had threads, and they say, are the threads going to be visible, or the threads are going to cause surface damage to my skin. So it's all about using the correct thread in the right area, and then also to ensure that you're the right patient for the threads, and then get the right practitioner to insert the threads. So important with threads is to insert it on the correct plane. That's the subdermal area underneath the skin. And if you insert it too superficially, yes, then you can see the threads. Then you can, and that can take a long time to heal. If you insert the threads too deep, then you can hit structures like a nerve, a blood vessel, which just can cause bleeding or a bit of numbness. But it's about, like I mentioned, inserting it on the correct plane. So what can I expect after the thread lift? So important, it's not a facelift. Expectations are very important. If you're expecting a facelift, then go for a facelift. Rather, if you're expecting just a more subtle, natural lift with a bit of contouring and a bit of skin rejuvenation, then threads might be the right option for you.